You've just returned home from a beautiful tropical vacation, and as you open the front door, you are attacked by a dog with tiny frantic licks of affection. You've been gone for what must seem like forever to the young German Shepherd, but what neither of you realize is that within hours, you will have to leave again. This time to the hospital, where you will fight for your life as your limbs slowly turn black, all because of one wrong move from your puppy. Marie Traynor had only recently returned home from a vacation to Punta Cana when, on Friday, May 10th, 2019, she began feeling unwell with a backache and nausea. We just thought it was the flu, so I treated it like the flu. But by 2 or 3 in the morning the following day, after her temperature spiked and then dropped, she and her husband made the decision to visit the local Alliance Community Hospital emergency room. But later that same day, as her symptoms worsened, she was sent to Altman Hospital's medical intensive care unit. She was complaining of agonizing pain in her hands and legs, and by Sunday, May 12th, became unable to breathe on her own, so doctors decided to put her on life support and a medically induced coma. Marie's stepdaughter, Gina Premier, who's a nurse at the same hospital Marie had become a patient in, said, "We didn't know exactly what it was, but we knew it was an infection of some sort. Medical staff were unable to pinpoint the cause of the infection plaguing Marie's body, and the following day, they informed her family that, whatever it was, it had attacked the small blood vessels in each of her limbs. Gangrene was setting in, and blood clots were cutting off blood flow to Marie's arms and legs, causing the skin and flesh to die." Marie's family couldn't believe what they were hearing. That was a pretty hard pill for us to all swallow. To say she was fine a couple days ago on vacation, and now she's actively getting worse by the minute, and now her hands and feet aren't alive? Like, this doesn't happen. It's 2019, said Gina. After accepting that there were no other options, doctors took Marie into surgery in order to save her life. Unfortunately, due to the amount of muscle damage from the infection, there was no hope in saving her legs. But after amputating them, doctors worked tirelessly to remove blood clots in her arms in an effort to save what they could. By the 7th hour, I had probably taken out over 40 or 50 clots, said her orthopedic surgeon, Dr. A.J. Seth. And on May 18th, 9 days after entering the hospital, Marie awoke from her medically induced coma to find that her legs and hands had been amputated and her life forever changed. Marie's doctors said this is off the scale, one of the worst cases we have seen in terms of how ill people become with infections. She was close to death. But what had even caused the infection in the first place? It was difficult to identify, said Dr. Margaret Kobe, the medical director of infectious disease who treated Marie. "We're kind of the detectives. We went through all these diagnoses until we could narrow things down. And narrow things down they did. Because 7 days after being presented with Marie's case, a cultured blood sample revealed to doctors the source of the infection to be a bacterium called Capnocytophaga canemorsis. After surgery, Marie was put on antibiotics to kill the bacteria in question and blood thinners to prevent more blood clots from forming. On July 14th, a GoFundMe page was created by Marie's son, Matthew, who wrote that his mother had gone through 6 surgeries to date and was over 60 days into this hospitalization and the fight of her life. But what exactly is Capnocytophaga canemorsis, and how did Marie contract it? Well, it wasn't something she picked up while on her tropical vacation. Nope, it was much closer to home than that. We learned from the infectious disease specialist that this was a normal flora/normal bacteria native to all dogs and most cats' mouths. Though rare, the bacteria usually passes from dogs or cats to humans through bites or scratches. And it seems that when Marie got home, her German Shepherd puppy licked an already slightly infected cut. It was just a random and rare occurrence that caused the perfect storm within her body, resulting in the devastating illness. But Marie didn't hold any hard feelings towards her pup and actually asked doctors if her 2 dogs were allowed to visit her while she recovered. "They brought them here 2 times at the hospital, so I can see them, and that just put the biggest smile on my face," Marie said. She eventually recovered enough to be transferred from the hospital to a rehab facility where, over the course of the following year, little by little, she learned to use her new prosthetic legs, wrists, and hands. "I've been feeling very good. They're healing very well. I'm so ready to move forward." So, take it from Marie and be cautious. Make sure even the tiniest wounds are treated and dressed properly, especially if you expect to be getting any puppy love from your furry friends.